Okay. We have been told by the mainstream media that there is an outbreak of measles cases, that this is a troubling report, we are told. These measles cases are in Texas and New Mexico, and according to almost any mainstream media outlet that you open today, this is clearly a coordinated narrative coming from them. The number of measles cases in Texas and New Mexico have risen by 28 cases in the past 5 days as this so-called outbreak spreads. Now, you can tell by the way that I'm phrasing this that I am skeptical of their phrasing, that they're attempting to make the perception of this as if that this is a highly contagious mass outbreak. They're in a sense trying to COVID-19 it. But I also understand that many people do not want measles. I don't want to get measles either. I don't want to get anything. But I don't like to be sick. I try to avoid it. But I do think it's important to understand a few facts about what is happening in Texas and New Mexico as related to these measles cases that the mainstream media is trying to obfuscate. I want to make sure that you have the full breadth of knowledge about what's happening here. So in order to do that, I think it's important that we read this article. This is from Reuters. Reuters says Texas and New Mexico on Tuesday reported an increase of 28 cases of measles in the past 5 days, bringing the total known infections to 256 in the two states since the outbreak began in late January. The outbreak, which started in West Texas, caused the first U.S. measles death in a decade. It is also proved to be the first major challenge for U.S. Health Secretary Robert F. Kennedy Jr., a longtime vaccine skeptic. Now, let's pause there for just a second. This is, of course, why they are presenting this story. They're not presenting how many people have contracted influenza or how many people, even children, who have died from influenza. They are presenting this story about this small number of measles cases because they don't like RFK Jr. They've painted him as a dangerous anti-vaxxer, and they want you to associate a fear of measles or even one person dying of the measles, may God rest, give rest to that person's soul, with RFK Jr. So just a note on that. Reuters goes on to say, as of March 11th, cases reported in Texas rose to 223 from 198 on March 7th, and hospitalizations rose to 29 from 23. In Gaines County, which is the center of the outbreak, infections increased to 156. This is according to Texas Department of State Health Services. In New Mexico, cases rose from 30 to 33, including one case in a county that where none had been reported previously. Last week, the state reported that an unvaccinated adult who had died tested positive for measles. Medical examiners were still investigating the case, its first measles-related death. So let's pause there for 1 second. The way that this is phrased should raise our red flags. An unvaccinated adult. Now, an unvaccinated adult in southern Texas is another way of saying that this person is an illegal alien. That this person, and they don't report that, but I'm confident in my speculation because part of the role of the Border Patrol is to protect the American people from contagious disease. That's part of what securing our border means. It's not just protecting our border from individuals coming who would, change the culture of our country or overwhelm our welfare system or commit crimes or traffic drugs. It's also to protect our nation from diseases that are no longer prevalent in the United States. Reuters doesn't mention the immigration status of this individual, and I suspect that oversight is intentional. The other part of that sentence, last week, the state reported that an unvaccinated adult who had died tested positive for measles. Well, that's a strange way to construct a sentence. So did this person die from measles, or did this person die and then also had a positive measles test? Because I recall not too many years ago that we were told that a motorcyclist had died from COVID-19 when in fact that motorcyclist died as a result of a motorcycle crash and then in the autopsy also tested positive for COVID-19. So not exactly the same thing to die with a disease as it is to die from a disease. And yet Reuters does not make that distinction, which also raises red flags. The CDC told doctors last week, according to Reuters, the risk for widespread measles in the U.S. was low due to robust immunization surveillance programs and the country's capacity to respond. And then, of course, the most interesting part of all. Reuters says the measles, mumps, and rubella, MMR vaccine, is the most important tool for preventing measles, the CDC said. The health departments of both the affected states said 80 patients in Texas and 27 in New Mexico were unvaccinated. Okay, well, let's do the math here for just 1 second. If there are 223 total measles cases in Texas, according to Reuters, and 80 patients in Texas are unvaccinated, then the math is very simple here. 80 divided by 223 means that only 35% of those who contracted measles are unvaccinated, which means that 65% of those who contracted measles are vaccinated. Well, funny how Reuters, funny how the CDC, funny how nobody telling you how important the MMR vaccine is mentions that 2/3 of the people who got measles in this so-called outbreaks in Texas were in fact vaccinated against it. And the same thing in New Mexico. 33 total people have contracted measles in New Mexico, and 27 of those 33 are unvaccinated. Now, that's a higher rate. It means that 81% who have contracted measles in New Mexico are unvaccinated, but it also means that 19%, 2 out of 10, were vaccinated against measles. That's a pretty significant percentage of those who contracted measles having taken the vaccine that we are told, perhaps, like COVID, is both safe and effective. This is why people don't trust the public health officials in our country. This is why people don't trust doctors. This is why people are skeptical. This is why people turn to individuals like RFK Jr., who analyzes the situation when it comes to the question of, is measles dangerous for your child? If you contract this disease, is your child likely to die? How fearful do you as a parent need to be about contracting measles? RFK Jr., the reason so many people trust him, the reason the MAHA movement is so strong and so powerful and growing by the day is because RFK Jr. doesn't try to obfuscate actual data in order to manipulate your perception of the situation. He simply knows the information about measles, about the vaccine, and about children who die from measles, and he tells you that in an upfront way so that you have the information you need to make an informed decision. For example, RFK Jr. was asked by John Stossel about children who die from measles, and this is what RFK said. Take a listen.
Used to die from those diseases.
Well, you know what? They died in the 1900s or early 1900s. There were about 10,000 Americans a year who died. In 1964, there was about 300 or 400 who died, and they were almost all severely malnourished kids, mainly from the Mississippi Delta. This was before the poverty program, so there was a lot of starving children in our country. It's very, very hard to kill a healthy child with any infectious disease, but particularly with measles. And the World Health Organization now says vitamin A is an absolute cure for measles, which we didn't know about back then. Back then, we were treated with chicken soup, and it was, a week at home watching Leave It to Beaver, and every kid caught it. Every single kid got it. And I had 11 brothers and sisters, and we all got it, and we were all fine. And there are lots and lots of studies out there now that show that kids who get measles as a child are much healthier when they grow up, that they're much more resistant to cancers, to atopic diseases, to allergies, and to heart disease.
And that is why the vast majority of the American people no longer trust our public health officials, because our public health officials present, even Reuters, which is supposed to be one of the wire services, they're supposed to just report the facts, and they're not supposed to add any additional subjective commentary into their presentation. But what do? They fearmonger. And you contrast that with RFK. You listen to RFK and you're like, okay, now I have some information and I can build my own algorithm. I can understand whether it be measles or any other disease, whether this is a threat to me, whether it's something that I should be worried about, what I should do if it happens in order to reduce my likelihood of it being fatal for me or for my children. He respects you. That's the difference between RFK. He respects you enough to tell you the truth. But vitamin A seems to me to be very similar to what we have been talking about on this show about ivermectin, that vitamin A should be the first line of defense. This should be the first thing that public health officials recommend, whether it's the FDA or the CDC, whether it's the American Academy of Pediatrics, whether it's your own pediatrician, your family doctor. The first thing that should be recommended is if your child contracts measles, give them vitamin A according to XYZ protocol that prevents fatalities. This should be in the medicine cabinet of every mother across the country with every child. And because it's not, we should ask ourselves why. Why are we not told the truth? According to Dr. Alfred Sommer, he's at the MHS Bloomberg School of Public Health, he says, plain and simple, to improve clinical outcomes, children with measles need age-appropriate doses of vitamin A, period. He said vitamin A treatment of children with measles in resource-limited countries have been associated with decreased morbidity and mortality rates. Low serum concentrations of vitamin A also have been found in children in the US, and children with more severe measles illnesses have lower vitamin A. Now, that's not from Dr. Sommer specifically. That's, I believe, from the National Foundation of Infectious Diseases. But why aren't we told this? Why is this hidden from us? Why are we treated as if we are stupid? Why are we treated as people, less than people? Why are we manipulated by our public health officials? And the answer to that, I think we all know the answer to that. But some critical facts that are important about this so-called measles outbreak before you freak out and before you believe the headlines from places like Reuters.